April 8th, 2025. Would anybody like to make a motion?
I will make a motion to approve the minutes from April 2025.
April 8th, 2025, yeah.
I second.
Okay, all those in favor say aye. Aye. Any opposed, say nay. All right, the minutes from April 8th, 2025 are approved. On to new and unfinished business. Review and discussion of section 2.6 of the McHenry County Department of Health Personnel Policy. Who wants to take it away?
Okay, we'll probably do a little tag teaming. A couple things. So I have printed off the CDC recommendations and the IDPH high-level summary recommendations. So as you know, we have had a COVID vaccination requirement. We have a flu vaccination requirement. So that 2.6 section in from the personnel policies is related to employee vaccination requirements. So this came about the way the language in the policy reads now that we had adopted in prior years was that we're going to follow the CDC recommendation. Hopefully, as everybody in the room knows, those recommendations have changed and they've been revised a number of times. They started much more restrictive and have progressively kind of come closer to what we might expect. So in the interim, the state, and I think other states, have developed their own recommendations based on, they have their own committees now reviewing the long-standing science and practice of these recommendations. So we're here tonight to talk about some of the language in our policy. We're looking for a recommendation of whether or not to continue requiring the COVID shot. The primary difference between these two documents is where it stands now. So on September 23rd, the state put out its recommendation. Now keep in mind, this is after CDC had made multiple recommendations and changes. So where it stands now, IDPH is recommending the COVID-19 vaccination for all 18 years and older. The CDC recommendation is, and it's on the second page, it's colored. It's the first one at the top. So they are recommending for 19 and above. But if you'll notice, in parentheses, it says see notes. So if you go to the back, to the appendix, well, before the appendix, there's a notes section. And the first section in the notes section is on COVID-19. That is on page 4. So top center. So this is where they talk about shared clinical decision-making. And then the language in the CDC recommendation says vaccination based on individual-based decision-making. I don't really understand that, if I'm being perfectly honest, when it's talking about shared decision-making and then it talks about individual decision-making. But nonetheless, those are the, I would say, subtle differences between the two recommendations. So we need to square that up because our policies now say we will follow the CDC recommendation. However, IDPH has put out their own guidelines and recommendations, which differ slightly from the CDC's. So if we are going to follow IDPH, for example, we would need to amend the language. And then I think there's just a broader question lingering out there, which we have had discussions about in the past, is whether or not we will continue to require it. Some people recommend it, but don't require it as part of the employee list of vaccinations. And that's kind of, does anybody have anything to add?
Just looking at this very quickly, it looks like they actually conform with each other. It's, for a CDC says, everyone 19 to everybody.
Yeah, one says 18 and over, and one says 19. But keep in mind, again, it went through lots of iterations when we started this process.
Sure. This is pretty updated. This is October 7th.
Exactly.
So it's fresh. to me, they're saying they want a dose of the 2025-2026 vaccine, which is the newest one. I thought they gave just one, but
Like the semantics are vaccination is based on shared clinical decision-making and or individual decision-making, depending on where you're reading it in the CDC guidelines, and the IDPH guidelines are recommending the vaccine for adults. That is like the key
sure.
semantic difference between.
Now, this is just for the lay public, correct? This
But
isn't saying
they
like,
know
this
differing-
isn't saying like healthcare workers.
They're not, neither entity made specific
Correct.
guidelines for that.
We tend to require, or we have a higher expectation for healthcare workers to be protected against something that can transmit to their patients than the general public, correct? Or is there a lesser?
Well, we have, so the policy has been consistent since the pandemic that we have required it. We have argued it protects not only the patients that we serve or the public that we serve, but it's also protection for our workforce, right? And hopefully keeps our workforce in-house working rather than being exposed and getting ill. So I think if I speak for everyone, I will speak for myself, but I think I speak for everyone. You know, we see value in continuing to have it as a requirement, if not highly recommended. I think the other issue that we were facing prior to getting here today actually was the availability of the vaccine. We weren't sure we were going to be able to get it. So a lot of things have changed even just in the short, I'd say last week.
Have we received it?
We have vaccine on hand as of yesterday for VFC and adults that qualify. So we don't provide it to the general public. That's Vaccines for Children program.
Medicaid.
So Medicaid, like those who qualify.
What about our employees?
Well,
we would order it.
I'm waiting for that
and we can get
decision.
it quickly.
Got it.
I have a 1 to 2 day lead time at this point based on the supplier that we had that we used for the flu vaccine. Previously, they didn't have it available. Now they're saying 1 to 2 days and I can get it on hand.
So what language needs to change in these in order to have the highest standard?
Well, if we just say we're following the CDC recommendation, then we're looking at the one document that says
The shared clinical
decision-making.
based
And
on
then the
individual.
sub-language there says based on individual-based decision-making. So that's not clear to me personally. And then I think what we're saying there is it's dependent on the individual. Somebody who wants it, we get it, and somebody who doesn't want it. We still, for all the vaccines, have a medical exemption and religious exemption.
Okay.
So are we proposing to change it to the IDPH language? 'Cause
I
that's-
would
Or we could
think
broaden the
Let's
language.
just say whichever is more protective.
I would say that I would be okay with that if we know it's gonna be accessible. Because I don't think it's fair to say our employees that it's gonna be required when the department won't be able to have that accessible. If it's accessible,
Well, and we say, so we already have some language in there if we need to tighten that up, but we do say vaccine requirements may be temporarily waived if the department is unable to purchase the vaccine and or the employee is unable to get immunized due to the availability of the vaccine.
okay.
So we could make it that the language said by CDC recommendation and or by the recommendations put forth by IDPH, broadening the scope and allowing it to be applicable for whatever administration and whatever issue is happening with the CDC or
Right.
Yeah,
And we could
I
also,
kinda like
broader
that.
public.
Mhm.
or we could say also something to the effect that on an annual basis, like in consultation with the medical director, will review the recommendations and guidance from CDC and IDPH, right? And then bring a recommendation back to the Board of Health.
I mean, cause that's kind of what we're doing right now.
That's kind of what we're doing right now,
at
exactly.
both. It's just putting that wording in the policy.
Correct, because it's not there now.
This is not dissimilar from other legal issues of any kind between state and federal government, where oftentimes there's language that would say like, you know, whichever is more restrictive applies. I'm thinking of like HIPAA versus Illinois, you know, medical privacy law, or really any laws, like, you know, anything. So I think something that just takes into account both of them, and I trust that the state is putting a lot of intelligent people on this, a lot of time and effort to determine it, and I think, maybe some language in there about, I like the idea of taking it, with our, medical director's advisement, so like if we're unable to get vaccine or that we happen to have a shortage or something, I don't mean just even for COVID, but anything, I don't want somebody held responsible, and I'm certain that wouldn't happen, but
But it doesn't hurt to add language so that people
right.
make staff comfortable that
Right.
nobody's gonna be.
right, I don't want anybody worried about it.
Mhm. But they would need to go out of their way.
Yeah.
Right, yeah, I mean, that go without saying that the deal is that if we're requiring something, we have to provide it.
I agree.
Do we currently?
We do, that's what we
She said
have
there-
done.
Okay.
she said
There
was-
are other health departments that require it, but don't pay for it, but we do, that's how we operate with flu and any of the vaccinations that are
I
required.
think that's great, I'd
I
much
think
rather.
that, I'd rather keep that.
Make
Hep
it
B,
convenient.
varicella, like if they find they're not immune or they don't have any record, they don't have to
Then
pay for
we
it.
give them the vaccine,
So that statement is just.
consistent for everything.
Across the board,
Yeah.
even though, I mean, like, there's an argument that the county pays for insurance or a portion of insurance. We don't take insurance, so we're not, if I sent you to an entity that took insurance, you would get the COVID shot theoretically for free.
Right.
Whereas we're gonna pay $123 a vaccine to give it,
Yeah, so
but like per person. So, I mean, I'm just saying broad scope. I'm not saying that that is the reason to do or not do, and if you're requiring it,
You're saying it's cost
you're
money.
encouraging someone to do the vaccine, you're requiring them to do it, you're providing it for them.
You
You're
don't
doing
have
for
to get it
someone
here. If
No,
I
they don't
have
have to.
No, and
insurance
there's
and I
people
choose
who've
to go.
already gotten the vaccine already that were available at pharmacies with insurance.
Yeah, I want whatever's easiest for them, for the person getting it, whatever's easiest for them, if we need to provide it, great, if they can get somewhere, great, okay.
The Jewel gives you a 10% coupon every vaccine you get,
Oh,
up to $200.
Got some popcorn at
we
CVS.
are unable to
I got my coupon for
match
this.
Juul's offer.
Huh?
What?
We're unable to match Juul's incentives.
10% off
It's
your
just
next
10%.
water test, like that,
Yeah.
Their prices are pretty high.
Okay, do we have an idea what specific language you would want to see? Just hearing the other board members, it sounds like we're all on the same.
Including, I think including both.
What language, would you recommend language about, even as I said, protective, right, might mean different things for different people. So what maybe is good language, more restrictive, more,
What Lindsay said?
Yeah, like vaccine series
What'd you
as
say?
determined by the CDC and.
And/or recommendations put
And-
forth by Illinois Department.
I mean, you could put under advisement
Or a
by the medical
combination
director
thereof.
and the guidelines set forth by IDPH and or the CDC.
I don't want,
Recommendations will be made or reviewed on an annual basis regarding the vaccines or something to that effect with the current.
I think we should be cautious not to have language that can be misconstrued to say, oh, I can choose from either of these.
No, I agree. So I put something down, just.
Screensaver, my
So-
child.
The Department of Health, in consultation with the medical director, will annually review the guidance and recommendation from the Illinois Department of Public Health and the Centers for Disease Control and Prevention, and make recommendations to the Board of Health for healthcare worker vaccinations and TB screening, or something
Yeah,
ish.
because who knows what the CDC is
It
gonna
could change
recommend
again.
by next year.
That's right.
So I like,
We're broadening the options.
Right,
Actually, Deb Dorans, our staff development coordinator, is that?
right here.
Yeah, so there's a language in here, current schedule of required vaccines and TB screening is available from the staff development coordinator. Is that just this list, or you put out an additional one that says,
No,
this is what it is, okay. Okay, so these could change, even this document based on that, but I think it's a good thing to have additional language in there.
Having and instead of and or.
Yeah, then we're committed to, like, we are reviewing both. right?
We're not- yeah.
And then,
Here's the
you know, the state's
recommendation.
gonna put out guidance, CDC's gonna put out guidance, and then we collectively bring a recommendation, the board decides, yeah, I wanna go this route, or I wanna go this route.
And then we're just adding that so they know that we looked at both to determine whatever it was, instead of just one and then not having, because they could differ greatly, but we're
Right, and
looking at both of them.
before we got here, they did differ much more than they do right now.
Which is part of the reason
So
why
it
we had an
changed just in the
access issue.
last week or when we, you know, called the meeting, basically.
Yeah.
But do you think that we need to say something like, we're gonna review both, but we're gonna continue to follow the highest, most protective level of care? Not those words, but I'm just thinking like when Kyle was saying, sometimes like in my field, like ethics and legality is different, and oftentimes ethics will have a higher standard than a legal standard, and so we're always following whatever the higher standard is for best patient care,
Yeah, that's what I want to. I like that, some sort of language to that effect.
but not the words I use.
So something like a higher you know, best practice or,
Yeah, I could probably try to look up my ethics code, but that sounds hard.
That's
Do you know what I mean? Like,
Mhm.
like if IDPH is recommending something right now safer at a higher level of care for people in healthcare versus the CDC, we want to follow what IDPH.
We will look at both, but we will determine our decision based on the higher
The
level.
highest standard.
The
Yeah,
highest
I don't know
standard.
what-
I don't know the wording.
I don't know what that
highest.
phrase is in healthcare.
Does anyone have language they would like to offer specifically? Dr. Tomaso, Dr. DeRay, anyone? Or I can sit here and come up with something.
Well, I just want to clarify, we had required the yearly COVID vaccine.
we have.
So are we still doing that? We just need to, it's just a language issue.
It's still in there.
Well, I think that was part of it is, so when we set out to have this meeting, the language was different. So that's how many times it's changed.
Right.
And so and the language in our document currently says we're following CDC. So that would mean then that we would not necessarily be requiring it.
You'd be letting
Thus
people.
triggering a need to come here and
Yeah.
have this conversation.
And I don't want to do this repeatedly, and we can already
I
anticipate
agree.
other changes in the future. Let's just make the language change now. That we're gonna choose the higher standard of care, offering the highest form of protection based on consultation of the medical director upon reviewing CDC and IDP recommendations. I think that was a language right there. I don't.
No one wrote it down.
According to AI, when state and federal healthcare recommendations differ, medical professionals should prioritize the highest standard of care, which often means following the more cautious or proactive guidance based on their professional judgment and local context.
What was the wording, the highest level of?
Care, high standard of care?
To uphold the
standard.
highest level of clinical and public health standards, to promote the highest quality of care and safety for staff and the community, to meet established standards of health and safety, to reflect best practices in disease prevention and control, just throwing some options out there.
I think you understand,
I like that.
or I
All
think
those are great.
we all understand the direction we want to go. Do you?
To reflect
do you want a
best
motion
practices
on
in
language?
disease prevention and control.
Do you
Like
want to
that
make a specific motion or that we will incorporate this and bring back?
I would rather just get it done.
Okay.
Well, either way, it's gotta go to the full board.
It does have to go to the full board.
Do we need to approve the language here before it goes to the whole board?
I would recommend that, otherwise we would be bringing a
Going back.
draft, you know, and
Yeah.
say, per the conversation, we drafted language based on this conversation.
Let's,
I think we liked to reflect best practices in disease prevention and control.
you're gonna add that
Please
to
To
which?
reflect best practices in disease prevention and control.
I like that.
Best can mean different things to different people, so
Well,
I
I
appreciate that
mean-
we reference.
Highest level,
I would
You're
like,
still
Highest
gonna, like, the
standard.
medical director's reviewing it, you're still reviewing
Right.
all of the guidelines, and it's best practice based on
I just
What
like,
is
Or highest standard of
I would like IDPH
That's gonna differ
referenced
now,
in
no
that.
matter what, like depending on who you're
Yeah,
talking to.
it's not like Dunkin' Donuts has the best donuts, like it's not an opinion, it's called like evidence-based care, best practices, like it's like medical terminology. I hear what you're saying, but
Let's
that's like.
just make sure we reference IDPH to that.
Oh, I think that it definitely will. I think it's just an add-on based on,
Okay, could it be something like this then? The
Yes.
Department of Health, in consultation with the medical director, will annually review the guidance and recommendation from the Illinois Department of Public Health and the Centers for Disease Control and make a recommendation to the Board of Health that reflects best practices in disease prevention and control or reflects, highest standard of care.
Sure. Which portion are you?
determined
Okay, so
by
I have,
the,
just to be clear,
Paragraph
so
2,
paragraph 2, under specific vaccines, right?
Yeah.
Right after it says, it's like third, fourth sentence,
the
the
department.
Department of Health,
Mm-hmm,
in consultation with the medical director,
mm-hmm.
will annually review guidance and recommendations from the Illinois Department of Public Health and the Centers for Disease Control and Prevention, and make recommendations to the Board of Health for healthcare worker vaccinations and TB screening that
I like prioritize, I feel like.
that prioritize the highest standard of care and disease prevention and control.
Sounds good.
so we're not gonna add CDC and,
No, that's already.
It's already-
It is already in
Oh,
there.
it's at-
Yep,
okay,
yep. Do you want, here, how about I repeat it?
okay.
Okay,
Thanks.
one more time, and then
I'll
I'd
pay
like a
attention.
motion on this, and
Okay.
we'll move on.
So here's where it's at right now. The Department of Health, in consultation with the medical director, will annually review guidance and recommendations from the Illinois Department of Public Health and the Centers for Disease Control and Prevention, and make recommendations to the Board of Health for healthcare worker vaccinations and TB screening that prioritize the highest standard of care and disease prevention and control. I think that could be tightened up a little.
Sounds
Or two sentences, like sentence number 1, and then period, sentence number 2 with the medical director will review, right? There was a place in there where I'm like, oh, that could be a pause, but only to tighten it up.
I like either of those. And this is just for healthcare workers?
Oh, okay, so what if we go, okay.
Do you wanna put the Department of Health instead of healthcare workers?
I would rather,
Because we're not, technically, everybody isn't a healthcare worker.
For employee vaccinations?
Sure.
what's our,
Okay.
all department personnel have a role in the public health and safety, that's what it says. Do we currently require the same vaccinations for all?
No.
No.
The rest of the county does not.
No,
Just,
but the recommendations vary based on your role. So nurses have certain vaccines that nobody else has to have.
just like
Animal control
animal
has to
control,
have,
the
rabies, yep.
Okay. All right, I'm good with that.
Okay, so taking Melissa's suggestion, so if we break it up and say the Department of Health, in consultation with the medical director, will annually review the guidance and recommendations from the Illinois Department of Public Health and Centers for Disease Control and Prevention, and make recommendations to the Board of Health for employee vaccinations and TB screenings, period. The recommendations will prioritize the highest standard of care and disease prevention and control or something.
You could say the recommendations will be made to align with evidence-based best practices in infection prevention. Do you like that?
Yeah, but best practice, that's kind of redundant. You could just choose one or the other evidence-based. But also,
I think we've already hit it, so maybe a less is more, I think you've hit the, right?
I think also to say something on the requirement, so like towards the end of that, to say like the recommendation, and possible requirement at the time for vaccinations and TB screening.
Okay, please repeat that.
Okay, can you read it? I'll tell you where I was.
Do you want me to read all of it again? I mean,
Yeah, Well, I mean,
It's
yeah.
kind of hard when
It was towards the end, but
Do you wanna email it
the
to us right now?
Department of Health, in consultation with the medical director, will annually review the guidance and recommendation from the Illinois Department of Public Health and the Centers for Disease Control and Prevention, and make recommendations to the Board of Health for employee vaccinations and TB screening. Period.
and requirements.
Screening and requirements, TB screening and requirements.
Yeah,
And
no, it would be recommendation.
We already have a lot more language in this document also about.
required.
So we're just,
Okay. Then the recommendations will prioritize the highest standard of care and disease prevention and control.
I like it.
You added,
I just broke them into two sentences.
yeah, I knew that part. Read the first sentence.
Dr. Tomaso wanted the addition of requirements. Okay.
Yes, requirements is right after recommendations, right?
No. Okay, so the top of the document says all personnel have a role in public health, vaccinations, yada, yada. I mean, the heading of the section is vaccination and TB screening requirements.
Okay.
So, but if we felt like we needed to reemphasize that, I'm gonna read again. Department of Health, in consultation with the medical director, will annually review the guidance and recommendations from the Illinois Department of Public Health and the Centers for Disease Control and Prevention, and make recommendations to the Board of Health for employee vaccinations and TB screening and requirements? Or just MTB?
Recommendations and or requirements?
Yeah, the we were
Recommendations
saying
and requirements to the Board of Health.
for
Employee vaccinations and
Yes.
TB screening.
Yes.
Recommendations and
requirements for,
to the Board of Health for employee vaccinations and TB screening.
Mhm.
The recommendations and requirements
Mm.
probably should be recommendations and, like, does that bear repeating?
Mm.
The recommendations will prioritize the highest standard of care in disease prevention and control.
I think recommendations is fine. I don't think it is.
Or should we say standard of care in vaccine preventable disease?
I don't want to get overly
Okay.
specific.
Got it.
At the end of the
Maybe
day,
just add current,
I'm sorry, say that again?
just add the current, like, so if you read your last sentence.
I don't have what she has. Okay.
Oh, something to the effect of the recommendations will prioritize the
current.
current highest standard of care?
Isn't it current if we're reviewing it annually?
Yeah.
It's current anyway, right?
sounds good. I like all the work and thought that's been put into it. Would anybody like to offer a motion on the language we just discussed?
Okay.
It's gotta be one of you two.
Okay, but
together.
say that, I motion the wording of their, because I don't have it to read it.
I'd like to make a motion to approve the language as already discussed and
Okay.
presented by the public health administrator for approval to the Board of Health.
Okay, I would like to make a motion to approve the wording that was just discussed.
For review,
For
for recommendation to the Board of Health for approval.
For recommendation for the Board of Health for approval.
I will second that.
Wonderful. All those in favor say aye.
Aye.
Aye. Any opposed, say nay. Okay. Motion passes. Great.
Great, so great.
Thank you very much. All right, so we have a need to go to executive session. Thank you all for being
Thank
here,
you.
who stuck around. Appreciate you. We need a motion to go to executive session to, for exception 5 ILCS 120/2C1.
Are you saying that?
Yeah.
Okay, can I borrow that? Yes. I will make a motion to go into executive session for ILCS 120/2-1 personnel
I second.
meeting.
All those in favor say aye. Aye. Aye.
Aye.
Aye. Any opposed say nay. All right, we're gonna